recovery after a face and neck lift involves a few things. So the first thing is to keep all the skin alive, and you keep the skin alive by avoiding any and all nicotine containing substances. Don't go to a casino, don't be around anybody who's smoking. The other thing I need you to do is to minimize the risk of any late bleeding or hematoma. So stay calm, try to relax, take your blood pressure medicine as prescribed, and do your best to keep your head elevated above your heart to minimize the venous pressure in your face. The next couple of things to keep in mind are I want you to keep the incisions moist. So the incisions after face and neck lift are along your hairline, in front of your ear, and behind your ear. And all those incisions you just keep moist with bacitracin or Aquaphor. There's really nothing else you need to do with the incisions other than keep them clean with warm soapy water and moist with ointments such as Aquaphor and bacitracin. The sutures along the front of your ear and in front of your hairline here will be removed after 5 days. The sutures behind your ear will dissolve, and the staples back here in your hairline I remove last at 10 to 14 days. Now, the reason we use staples in your hairline behind your ear is because staples do the best job preserving your hair follicles. In other words, if I used a bunch of sutures in your hair, you'd be more likely to develop bald spots in those areas. And we don't want that. And staples do a better job minimizing alopecia. So that is why staples are used back here in your hair. Immediately following the operation, you're going to be bandaged up, and we will leave that bandage in place until the next day. The next day I will take the bandages off and remove the drain. I then want you to wear nothing on your face. I find that for the first week immediately following a face and neck lift, that the garments, the jaw bra garments, have a tendency to dig into your skin and cause more harm than benefit. So initially, I want you to just have no pressure, nothing tight on your face or neck, and I want you to sleep with your neck extended. Meaning I don't want you sleeping like this because it's going to make your neck wrinkle up. I want you to sleep with no pillow and your neck extended. So try and keep your neck kind of back like that, which will help the skin of your neckline tighten up the best as we can. So minimize sleeping with a pillow, keep your neck extended for the first couple months following the operation. Right away for the first week following the operation, keep your head above your heart and try and relax so we minimize the risk of you bleeding afterwards. After 48 hours, you can wash your hair and take a full shower, wash your whole face, get everything wet. When you're done showering, I want you to apply ointment to those healing incisions to keep them moist. If you feel up to it, you can exercise after 1 week, assuming everything is healing up correctly. If everything's healing up correctly, you can go swimming and submerge your head and neck underwater after 3 weeks. After 1 week, once your skin is a little bit stronger, if you have a significant amount of swelling under your chin in this area of your neck right here, I may put you in a piece of foam and a jaw bra to wear at night and while you're at home and at night for extra compression right here. But initially I find that it has a tendency to irritate and damage the skin, and the benefits do not outweigh the risks during that first week of healing. If all you had done was a face and neck lift, I find that the bruising and swelling is mostly subsided by 10 to 14 days. So you would be presentable at a informal function with some makeup or concealer on potentially after 10 to 14 days. If you had other procedures done to your eyes, fat grafting, laser resurfacing, the recovery will be a little bit longer as you have more to heal. One final point that I want to make is do not ice anything. You may think that icing your face will help minimize the bruising and swelling, and it may create some temporary short-term benefit, but you can also kill the skin because the ice is going to decrease blood flow to your fragile skin and may cause some of the skin to die, which would lead to wound healing problems. So it is not worth the temporary benefit of minimizing some swelling and bruising. Let it swell, let it bruise. Do not ice your face after a facelift. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.